Hi friends, welcome to Plexus Ortho. My name is Dr. Kanan Kumar and today we're going to discuss MCQ number 205 that we put up a couple of days ago in Telegram channel. So the MCQ question was as follows. A 20-year-old male presented with a dashboard injury. So you should understand what a dashboard injury is. And a right lower limb in flexion, adduction and internal rotation. What are the conditions which can cause the right lower limb in flexion, adduction, internal rotation and apparent shortening? It is posterior dislocation of the hip. What other injury can occur in this scenario? So in dashboard injury, there are multiple fractures and ligament tears that can occur. All of you should remember this very clearly. So the answer to this question is patellar fracture. Patellar fracture is the more common injury in this kind of a dashboard type of injury. So what has the patient suffered? The patient has had a posterior dislocation of the hip. Why do we call it a posterior dislocation of the hip? Because there is flexion, adduction and internal rotation. FADER is flexion, adduction and internal rotation, mnemonic for the position in which the posterior dislocation of the hip stays. So patient has a posterior dislocation of hip. What are the other injuries that can occur? You can have an acetabular injury, acetabular fracture. You can have a patellar fracture. You can have a PCL ligament injury. It is very common because if the dashboard or when the patient is getting hit, when the dashboard hits the lower or the just below the knee, the whole of the tibia goes posteriorly and this ruptures the posterior cruciate ligament injury. So what are the other injuries that can occur with a dashboard injury? One is a posterior dislocation, of course. Second is an acetabular fracture. Third is a patellar fracture. Fourth is a PCL injury. 5 is a meniscal injury. And 6, very rarely, a femur injury. So let's go back to the question. So it is patellar fracture is the best answer among all these answers. Bimalleolar fracture is not possible. And intertrochanteric fractures are also not possible because a dislocation occurs rather than an intertrochanteric fracture in dashboard injuries. So briefly, let's go over the types of dislocations of the hip. This is a very common question asked in your exams. Every other year you get a question on the dislocation of the hip. So therefore, you must know this really well. So let's begin with the most common dislocation of the hip. The most common dislocation of the hip is a posterior dislocation, which is the most common dislocation in the shoulder. It is an anterior dislocation. So posterior dislocation forms about 90 to 95% of all the cases of hip dislocations. 90 to 95% of all hip dislocations. So if you can see, the head is gone posterior, and what is the position of the limb that you see it in? FADER, that is flexion, adduction, internal rotation. That is a mnemonic for it. What will you see? Because the limb is in internal rotation, you cannot see the lesser trochanter. So the lesser trochanter is not visible in posterior dislocation of the hip because the whole of the limb is internally rotated. So the lesser trochanter is behind the whole of the femoral shaft, and therefore you cannot make it out. There is apparent shortening. We'll compare and contrast it with the anterior dislocation of the hip, but as of now, remember, there is apparent shortening with these dislocations. Vascular sign of Narath is positive. That means when you try to palpate the femoral artery, when the femoral artery pulsations are not felt, and this is a positive vascular sign of Narath. Why does this happen? When we usually palpate the femoral artery, we palpate against the neck of the femur. Now the neck has gone posteriorly and dislocated. You cannot feel the vascular sign of Narath cannot be seen. What are other associated injuries? You can have a sciatic nerve injury. What happens in a sciatic nerve injury? Sciatic nerve has two components. One is the common peroneal component and the second one is the tibial component. The common peroneal nerve component is more commonly affected, and therefore you have a foot drop. Okay, so sciatic nerve can be commonly affected in this condition. The next type of dislocation we can see in the hip is anterior dislocation, which forms about 5 to 10% of all dislocations. Is much less common. Okay, the mnemonic to remember here is flexion, abduction and external rotation. Faber. There's another Faber test all of you should know for sacroiliitis. Flexion, abduction and external rotation is done for checking the sacroilium issues. But here the position of the limb is in flexion, abduction and external rotation. The position in the posterior dislocation was flexion, adduction, adduction and internal rotation. So therefore here there is apparent lengthening of the limb in anterior dislocation of the hip. The lesser trochanter is more visible as compared to the opposite contralateral normal side because the limb is in external rotation. Okay, apparent lengthening, limb in external rotation, flexion, abduction, external rotation position. This is the contrasting feature between the posterior dislocation of the hip and anterior dislocation of the hip. Here, what is associated injury you can have? You can have what is called as a femoral artery injury because the femoral artery is right here, and so when the hip dislocates anteriorly, it can injure the femoral artery or cause thrombosis and issues with vascularity. Remember this. So what are the two different common types of dislocation? We have what is called as a posterior dislocation of the hip, which is more common. Anterior dislocation of the hip, less common. 90% posterior, less than 5% is anterior dislocation. The position of the limb is in fadir, that is flexion, adduction, adduction, internal rotation. In the anterior dislocation, it is Faber, flexion, abduction, and external rotation. Here you will have apparent shortening. Here you have apparent lengthening. Here you can see in the X-ray, you can not see the lesser trochanter. Here on the X-ray, you can see the lesser trochanter more prominently as compared to the contralateral side. And here the vascular sign of Narath is positive, right? You can have a sciatic nerve injury in the posterior dislocation. You can have a femoral artery injury in the anterior dislocation. So these are the comparison between the anterior and the posterior dislocations. This must be very clear because this question is asked very often. I hope this is clear to you now. Okay, very uncommonly you have another type of dislocation which is called as a central dislocation of the hip. So the central dislocation is where the acetabulum is broken through and the head migrates into the pelvis. This is called the central dislocation of the hip. The position of the limb is usually variable. It could be flexion, extension, depending on where it is fractured, but usually flexion. Internal, external rotation depends on how it is fractured and how it is dislocated. So usually flexion, external rotation or internal rotation can be there. Acetabulum is fractured in this condition, and you can have pelvic content injuries can happen, right? And of course there is shortening because of the impaction. Shortening will be seen, apparent shortening will be seen. So this is a very difficult condition to treat because you not only have to reduce the fracture, you also have to fix the acetabulum and make sure the fracture is fixed appropriately, and the prognosis is not as great as anterior and posterior dislocation of the hip. So with that we end the MCQ on a dashboard injury. So briefly the summary of what we have discussed in this MCQ was: one is in dashboard injury you can have multiple injuries. The most common is posterior dislocation of the hip, acetabular fractures, femur fracture, and in the knee you can have three things: patella fracture, PCL injury, posterior cruciate ligament injury, and meniscus injury. So these are the various injuries that you can have in a dashboard injury. Remember this. The three common types of dislocation of the hip are anterior dislocation, posterior dislocation, and central dislocation of the hip. In anterior dislocation of the hip, you have flexion, abduction, abduction, and external rotation, and apparent lengthening. In posterior dislocation, which is more common, you have fadir, that is flexion, adduction, and internal rotation. And central dislocation of the hip, you have the acetabular fracture where the whole of the femur impacts into the goes into the pelvic content. So that is in brief about dislocations of the hip. Thank you very much. My name is Dr. Kannan Kumar and this is Plexus Ortho. Thank you.